Hello, I'm Keith Barton. In a tertiary referral glaucoma practice, you will implant or encounter various types of glaucoma drainage tubes. The Baerveldt glaucoma implant is the most effective IOP lowering implant, but is very large. The huge Baerveldt contrasts dramatically with the MIGS trend towards much smaller subconjunctival tubes, such as the XEN and the PreserFlow. The Baerveldt plate is large for good reason, as this is responsible for the high long-term efficacy level. But at 640 microns in diameter, like the amide valve, the tube of the Baerveldt is larger than required. The 640 micron Baerveldt and amide valve tubes occupy almost the entire drainage angle. Such tubes are in contact with cornea at their entry site, even when lying flat on the iris. Tube contact with corneal endothelium at the entry site can kill endothelial cells. And a large tube on the scleral surface always carries a small risk of conjunctival erosion. This erosion risk is reduced but not eliminated by a donor tissue patch or a long scleral tunnel. Minimally invasive subconjunctival tubes such as the XEN Gel Implant are much smaller, as is the PreserFlow microshunt. MIGS tubes are not for complex cases, but do show that small tubes can produce a very large IOP drop. On gonioscopy, the size difference between the Baerveldt and the XEN is quite dramatic. And in this case, you can see that the Baerveldt is bigger than probably the two XENs put together. Even the slightly larger PreserFlow can fit inside the Baerveldt, though it is a very tight squeeze. With the smaller subconjunctival MIGS tubes, erosion can still occur, but it seems much less common, as seen here with the PreserFlow and here with the XEN Gel Implant. And a temporary fix can easily be achieved at the slit lamp, although obviously removing it is not a permanent solution. These smaller tubes likely carry a much lower risk of endothelial cell damage simply because of their size. However, the big tubes are also getting smaller. The pole glaucoma implant on the left has a smaller tube than conventional implants, although it has similar plate characteristics. The tube portion is not very much larger than a PreserFlow. Compare the tubes in luminal diameters here. The Baerveldt is the one on the top. Perhaps inspired by MIGS, even conventional tubes are becoming less invasive, possibly reducing the risk of exposure and endothelial cell loss. Thank you for watching.